Today we're going to begin our last topic for the current unit that we're in, which is euthanasia. This is a real heavy topic, so we're going to take it kind of slow and just start it today and then finish it up on Thursday, last little bit, because it's a very heavy, very serious topic. And a lot of people have some life experience with this topic. So, we kind of try to take it slow and make sure that everybody's on the same page and understands where I'm coming from. So, euthanasia comes from a Greek word that means good death or easy death. Sometimes people will use the term mercy killing, but that's actually not, I think, probably not a very super helpful way of describing what euthanasia actually is. The reason that the conversation about euthanasia is such a complicated one is because there's really two different types of euthanasia, and they're very, very different from each other from a moral perspective. So there's what we call active euthanasia and what we call passive euthanasia. I think you guys have probably, I'm hoping you guys have probably used these terms in like an English class or some other class where you've talked about what it means to be active versus passive. Active, when you're doing something active, you're doing something, you're causing something to happen. Whereas with passive, it means you're sort of just sitting back and allowing something to happen. You're not really causing it, you're just letting it happen. And that kind of helps us understand the distinction between euthanasia, whether it's active or passive. Those two categories are very different from the church's perspective, and they're very different from a moral perspective. So when it comes to active euthanasia, we're going to talk about that second, actually. That is one that's a real problem in the eyes of the church, and it's generally speaking, 99.99% of the time, it is considered a sin in the eyes of the church. Now, when we're talking about passive euthanasia, that's very different. It's generally not considered a sin. 99.999% of the time, passive euthanasia is considered morally acceptable, and it's not a problem in the eyes of the church. So the first thing we're going to talk about is that the church will distinguish between what are known as ordinary means and extraordinary means. Extraordinary. Sometimes we use that word. Extraordinary, we kind of think of it as just being like amazing or awesome, but in this case, it truly means like what the word actually means, extraordinary, which is beyond what is ordinary. So ordinary means of prolonging life are things like food or water. That's something that air to breathe, that these are things that everybody needs every day to prolong life. Those are the ordinary things that are expected to keep a person alive. Even you could consider like basic first aid or basic medical care to be ordinary means, because everybody who gets hurt, it's an ordinary thing to try to heal them, to try, put neosporin on a cut or put a Band-Aid on a cut, But even like an antibiotic is generally considered like an ordinary means of prolonging life. But then there are what we call extraordinary means of prolonging life. These are things that are not, generally speaking, not normal parts of what it would mean to prolong someone's life, to keep someone alive. So like a ventilator, we've heard a lot of talk about ventilators lately in the world being where it is. And oftentimes a ventilator can be considered an extraordinary mean. It's not something that most people would use in their daily life. So that's just kind of to get started in this idea of extraordinary versus ordinary, these two different types of euthanasia. So the first type of euthanasia we're going to talk about is passive. And like I said, generally speaking, passive is not a sin in the eyes of the church. There's really two types, two situations that are considered passive euthanasia. The whole idea of passive euthanasia is that you're doing something where you're allowing a person to die, but you're not causing a person to die. And I know that that sounds like I'm sort of making a very minute distinction there, but it's an important one. It's about intention. If you remember, we talked about way back when, what makes an act a sin? Well, what you did, the act itself, or the object chosen, and then the other one is your intention. In medical situations, in making decisions about family members who are in medical situations, you have to sometimes make a choice to allow a person to die. That's unfortunately a pretty normal part of the end of life care for a lot of us. And I'm guessing that probably many of your parents have had to go through those kinds of decisions for grandparents, or even maybe possibly for their parents. There's some tough decisions that have to be made there sometimes. So when we're talking about passive euthanasia, we're talking about two situations. The first one is anytime you do something that's meant to be palliative. Palliative is a fancy word that doctors and like people in hospice care use. Palliative care means that you're trying to reduce suffering. So you're doing something, you're giving the person a medication that's really meant to reduce their suffering, that's supposed to help, like a massive dose sometimes of a painkiller if they're in a lot of pain. What we're talking about here, basically, I'll give you kind of an example to help you understand it. Oftentimes when people are dying of like very advanced stages of things like cancer, they can often be suffering terribly. They can be in a lot of pain. And it's not unusual for doctors to make a choice to give those patients a very heavy dose of a painkiller like morphine, knowing, the doctors often will do this knowing that that heavy dose of morphine has a side effect that can depress the person's ability to breathe fully. And so sometimes the doctors will give that heavy dose of morphine knowing that it might, because of the way it affects their ability to breathe, might hasten their death or speed up their death. But the doctors do it because they also don't want the person to suffer. In the eyes of the church, there is nothing wrong with that, because your intention, you're not intending to kill the person. The doctor's intention is not to cause death. What is their intention? Their intention is to reduce their suffering. And so, because your intention is to reduce suffering and you're giving a medication that does that, your act is to give a medication to reduce pain, and your intention is to reduce pain, it's not a sin in the eyes of the church. The other situation, which is actually probably more common, and we had to make this decision with my dad. So, this is one of those that probably a lot of your families have had to make choices like this, where you had to make a decision to stop medical interventions. At some point, the doctor said, what we're doing isn't going to work. We're really just prolonging the inevitable. They're really probably not going to make it. And so we're just sort of forcing them to hang on longer for a reason that doesn't actually, we're not going to cure them. They're not going to get better. We're really just prolonging their suffering. In my dad's case, he had an advanced stage of pneumonia, and he was in advanced care of Alzheimer's. And so the doctor said, we need to take him off the ventilator because at this point, it's not helping and it's not really doing any good. And so we made a choice to take my dad off the ventilator. Again, in the eyes of the church, there is nothing wrong with this. It's not considered a sin. It's not a problem at all. The only time it could potentially be a problem is if, you're not sure if the person has a chance and possibly could survive. Of course, the church would say you need to do anything and everything you can to try to save their life. But at some point, when there's pretty widespread medical agreement that it's not going to happen, they would say it's okay, it's morally acceptable to allow the person to die. And again, the distinction is you're not trying to cause their death. you're allowing a natural death to occur. So you're getting out of the way because you know that you can't save their life. The way we would say this, right, is that sometimes technology can actually delay death rather than prolong life. So, sometimes cancer patients will opt to stop chemo treatments because they say, my quality of life and how bad the chemo makes me feel is worse, and I know I'm not going to make it, so I want to enjoy the time that I have left. And so they'll make a choice to stop treatment, knowing that, they might die more quickly, but also that they'll have a better quality of life with the time that they have left. Again, nothing wrong with that in the eyes of the church. It's considered morally acceptable because you're not causing them to die. You're simply allowing them to die. Right? Not a sin in the eyes of the church. Now, what is a sin in the eyes of the church is what's called active euthanasia. So active euthanasia is a situation where you're actually doing something to cause death. This is typically the most common version of this. There can be other situations, but really let's talk about what the most common version of this is called physician-assisted suicide. Physician-assisted suicide is legal only in a very small number of states in the United States. I think it's around 5 or 6, and actually your homework on Thursday is going to be to look a little bit more at physician-assisted suicide and the legal issues there. So physician-assisted suicide is legal in 5 or 6 states, maybe more. I haven't checked on the laws in the last month or two. Oftentimes, what will happen with physician-assisted suicide is that a person who lives in a state where it's legal has a terminal diagnosis, so they have some kind of a terminal illness that they will die from eventually, but they say, I don't want to suffer anymore. I don't want to go through this anymore. And so in states where physician-assisted suicide is legal, a doctor can prescribe a medication which essentially causes an instantaneous and a very severe heart attack that will cause almost instant death. And it's typically legal for people who already are diagnosed with a terminal illness like cancer, like an advanced end-stage cancer, something like that. And the doctor can prescribe that so that they can die immediately rather than maybe 6 or 8 months down the road. The problem with this in the eyes of the church is that your intention is very different. Again, we talked about what makes an act a sin, object and intention and all that stuff. In a case of active euthanasia and in a case of physician-assisted suicide, you are actively trying to cause the person to die. So you're doing something active, in other words, giving them a medication or whatever to cause death to occur. And so that's why physician-assisted suicide is considered a sin in the eyes of the church. You're not allowing them to die, you're causing them to die. You're doing something to hasten their death, and you intend to do it. So, like I said, it's a pretty serious topic. We're going to look on Thursday, we're going to look a little more specifically at this idea of physician-assisted suicide. So if you kind of feel like you don't have the full picture and exactly what that is, that's okay, because we're going to come back to it on Thursday. So take a pause here, and I'm going to ask you to answer some reflection questions for homework. These questions are really just about your opinion and what your thoughts. The church teaches that active euthanasia is a sin, but that doesn't necessarily mean that everybody agrees with the church's teaching. So I'm going to ask you to think about what your opinion is on these issues. Anyway, I hope you guys are doing